In 2019, the Department of Health and Human Services began requiring hospitals to list their prices online.
The Baker Institute at Rice University found that Texas hospitals have been slow to comply with the federal rules, particularly hospitals in Houston.
Health reporter Haley Hernandez is live outside some of those hospitals that were analyzed for this report. Haley.
That's right, Keith and Lauren. So this is a topic that I have discussed before on air and even off camera with health economist Vivian Ho. And now she is putting Baylor St. Luke's, Houston Methodist, and Memorial Hermann under a microscope and finding that there's a clear price difference between institutions. The economist at Rice compared St. Luke's, Memorial Hermann, and Houston Methodist and the negotiated deals they have between Aetna, Blue Cross, United Healthcare, and Humana. Prices are there, but not always easy to find.
If you go to the Houston Methodist main webpage and you go all the way down to the bottom right-hand corner, you will see price transparency. And you can click on that link and you will find a file. You wouldn't be able to understand that file because it's in a format called JSON.
This is in compliance, but not easy to understand.
The federal government is starting to hear complaints about this, and they are working towards a standardized format for all the hospitals, which will be a big improvement.
The most shocking revelation from her research is how cost of a procedure can vary greatly across hospitals. For example, these are the prices for a spinal fusion at Methodist, Memorial Hermann, and St. Luke's. And then take a look at this. This is for open heart surgery. Ho says if the goal is to ultimately drive down prices, employers need to negotiate benefits based on who can provide quality care at a low cost.
You need the employer to do it because they can drive a large number of customers towards the best, high quality, low cost care. Individual consumers aren't going to do that on their own. It's not going to be the same effect.
So Rice University put their findings in an Excel sheet, and it's clearly listed on their website. I've linked you to it on our website, click2houston.com. I should also mention that the Department of Health and Human Services can fine hospitals $5,500 a day if they are not compliant with posting their prices online. They say, though, that they're not fining anybody because nobody's reporting them. So if you've found that a hospital is not transparent with their prices and you'd like to report them, you can also find out how to do that, again, on our website, click2houston.com. Reporting live in the Medical Center, I'm Haley Hernandez, KPRC 2 News.
It's an interesting report. Haley, thank you.